Madam Clerk, do we have a quorum?
Yes.
All right. We will call the Committee on Health and Human Services meeting to order. Madam Clerk, what roll call, please?
Each member is acknowledging that they are attending the meeting via Zoom and that they are located in Wayne County, Michigan, unless otherwise stated when I call your name. Commissioner Marecki?
Here.
Commissioner Dobb?
Here.
Commissioner Anderson?
Here.
Commissioner Killeen?
Here.
Chair Baker McCormick?
Here.
You have a quorum present.
Next item.
B, Chairwoman's remarks.
I do have a brief remark today. This is in reference to our last meeting. There was a question in the procedure that I used in running the meeting. I used a process called general consent, or in Robert's Rules of Orders, you'll probably find it under unanimous consent. And it's a process used to help move a meeting along, to shorten a meeting. I mean, it's used all the time in various meetings. And if you want to discuss it further, of course, we can talk offline, but I just wanted to let you know that in this HHS meeting, we will sometimes use the general consent process. And just an example, in our last meeting, I asked for a motion to discuss and to receive and file, I think it was like items 1 through 7. It was moved and it was supported. And after the discussion, I said, if there are no objections, so moved. And that is all that needs to be done. We don't need to take a vote, because if there are no objections, then you do not have to do a vote. So I just wanted to explain that process for those that didn't understand what I was doing. And if, again, you have any further questions about it, feel free to reach out to me after the meeting. And you can also Google it. It's a standard procedure.
Madam Chair, I apologize. Yes. This is Felicia.
Yes.
But our rules require a vote. And we don't go by Roberts, we go by our own rules. Okay. Perhaps after this meeting, we can have a discussion so I can further understand what you're saying to see if there's an inconsistency. But I would suggest for this meeting that you actually take votes out of the committee, which I believe is required in our rules. And then we can discuss what you're referring to see how that melds, if at all, with the rules that the commission has adopted.
Okay, and that's why I called you, Felicia, about it. And you didn't seem to indicate that we were running it by our own set of rules, not necessarily Robert Rules of Order.
I misunderstood, because we don't use Robert. So my apologies for misunderstanding.
Okay, no problem. Yes, and so I would like some clarification if there's a different set of rules, how the commission runs. Again, this is my first time chairing this committee, so it's a little different than other boards that I've sat on that we use the Roberts rules. And yes, so if you can send me that information, then maybe that'll clarify some things for me as well. Thank you, Madam Clerk. Next item.
C, approval of the April 6, 2021 meeting minutes.
Is there a motion for approval? Okay.
Yeah.
Support. It's been moved and supported. All those in favor?
Aye.
Aye. Aye.
The motion passed. Next item, please.
D, finished business. There is none listed.
Next item.
Item 1, under new business, an update from Dr. Mahana Hamami regarding COVID-19.
Welcome, Dr. Hamami.
Thank you, Madam Chair. Good afternoon, everybody. Mohanad Hamami, Chief Health Strategist. Today, I will be giving the usual case numbers and an update on where we are, but I also would like to give you a little bit of our efforts to expand capacity and access to vaccines in Wayne County. So if I may share with you some slides. And I hope you can see my screen now.
Yes, we can.
Great. So let's start with the weekly case reports. This week is a relief because it is the first week in at least 3 weeks where we are seeing less cases. Our numbers have decreased by 9% from last week. It is still on the higher side, as you can see, 5,565. That is still way above the 900 and 600 that we enjoyed early on in the year. The death count has also decreased. I believe last week it was close to 30, and now we're at 12 cases. And if you look at the graph, also the 14-day look back is decreasing, which is exactly what we would like to see. The same applies. This is the first week where we see our positivity rate decreasing. And as you can see from the 2 periods before, it was on a climb from 18.3 for Wayne County to 19.5. We, as of yesterday, are at 16.3% for the county and 14.1 for the state of Michigan. So hopefully these are good signs that we are turning a page on the numbers of increasing. The same applies for most of our communities that are usually in the top 10 category. Not much has changed except some trading places. Almost all of the communities except with Dearborn and I believe Westland have decreased. I'm sorry, not Westland, Dearborn have decreased in their total number of cases, but in terms of the percentages, still, as you can see, Dearborn is the highest at 12%, followed by Westland at 8%, Canton at 7%, along with Livonia, 6% for Taylor, and 5% for Redford and Dearborn Heights, and then Belleville, Lincoln Park, and Southgate at 3% each. And then as far as the school-related cases or outbreaks, there were 3 new ones this week. Those that were are still ongoing. The outbreak happened in previous weeks, but we're still following up on that. But those 3 that happened this week, as you can see, they were reported on April 15th, are in Canton, Highland Park, and Northville. 2 of those are in elementary school and 1 is in a middle school. And we are back to seeing cases in staff and in students. We had a period where mostly it was in students, and now we're seeing a little bit of a mixed batch. So we're investigating those to see whether the staff involved were vaccinated or not, and if so, then we will follow up on that. The variants have also been increasing. Still, as of today, the majority of the variants that we see are the B117, which is the United Kingdom variant. The B1429, the California variant, is also increasing. And we have just registered 2 cases of the P1. This is the notorious Brazil or Japan-Brazil variant. This is one that we just documented it in Wayne County recently on March 29th. What does that mean? Because we know these variants are very highly spread and they have an increased transmissibility rate. I expect that the more we're going to test for the variants, we are going to find them, and we will see more of those. Because these are variants that have a higher virulence as well as a higher transmissibility, then again, this is where the emphasis on isolation of cases, the emphasis on physical distancing and face covering becomes very important. And that is probably a little insight to why we're seeing those high cases, because you have now less viruses that are needed to spread. And that's where we saw most of those spikes. As of last week, exactly on April 8th, we opened up all categories. So technically we are vaccinating everybody that is 16 and over in Wayne County at our sites. And I will talk a little bit more about our sites as we move to our next plan. This is our vaccine inventory. We have received, as of last Saturday, 264,150 doses of all vaccines. We have administered 22, that doesn't sound right. It should be 229,902. And we redistributed close to 50,000. By redistribution, as I mentioned in the past, it is giving it to other entities that can vaccinate. Now, all of you are aware that the Johnson & Johnson is on hold. We still have close to 9,000 doses that we are not using. And of the 12,800 redistributed, I believe Dearborn Fire Department has 4,000 and Livonia Fire Department has 3,000 that they are also not using until further notice. I wanted to take this opportunity to talk to you a little bit about our efforts to expand our vaccine access in Wayne County. So as you know, so far we have been operating consistently at 2 locations. One is in Livonia, which is Schoolcraft College, and the other is in Taylor, which is Wayne County Community College. One was designated specifically, which is the Taylor site for Pfizer, and the Schoolcraft College in Livonia is designated as Moderna. With more shipments of vaccines that we are getting, and also the demand of opening up to the category groups, we needed to expand our capacity. So we knew that we needed to have a robust scheduling system that can offer appointments. We heard about the challenges that many of our county residents, and specifically the seniors, that were unable to get vaccine appointments by going online. We also needed a system that can track our vaccine and keep the inventory of doses that are administered and doses that were remaining. And also we need the capacity, the manpower to administer more doses. And we needed to have more local access to vaccine by having more geographically distributed sites that people and residents in Wayne County can access. So with those 4 points in mind, we started with launching our own call center. The call center has been launched on April 8th, and it operates 5 days a week. And over the weekend, although there is no person that answers the phone, there is an answering system that is able to return calls the following day when someone leaves a call. It has the capacity of handling 7,500 calls per day and scheduling appointments. It has been actively involved in not only scheduling appointment, but also providing information. A lot of the calls sometimes are more about people that have concerns or they are seeking information. So we have established that the 866 or the 800 number that you see on the screen is what we have advertised, and it's what you can use with all your constituents and your residents in case they require an appointment for a vaccine. We also wanted to enhance our capacity at the 2 existing sites, the Taylor and the Livonia sites. So for doing that, we needed more vaccine administrators, and we needed to increase our hours of operations at those 2 sites. So we have increased our capacity to administer doses at the Downriver site, which is Wayne County Community College in Taylor, and we have increased our capacity from 1,500 doses to 3,000 doses per day. We also increased our operation per week from 3 days per week to 6 days per week. So we are literally Monday to Saturday at Wayne County Community College and have the ability to administer 3,000 doses per day starting this Monday. Yesterday was our first day. Schoolcraft Community College as well, we have increased our capacity with the same from 1,500 doses to 3,000 doses. And although our goal is to expand our operating hours to have 6 days a week, we have been inconsistently receiving Moderna doses from the state. In fact, this week, for example, we did not get any first doses of Moderna. So that remains limited hours based on the vaccine availability that we have. Currently, we have, like for this week, we have scheduled 4 days a week. If we have more Moderna coming next week, enough to operate for 6 days, then we will make sure that is happening. All this information is fed to our call center, and operators know exactly how many they can schedule on each day at which site. We also wanted to expand access to vaccine, as I mentioned, and have it more geographically accessible across Wayne County. This is a map of the county with the green circles are where we are currently, and the red circles are the new sites that we are proposing to, or we are going to establish. So we wanted to ensure that we have this distribution in the downriver area on the east side, as well as on all 4 corners of the county, while we still maintain our central presence as well. So we are launching 4 new vaccine sites. And of these vaccine sites, we are labeling them as large and medium. The only thing is that the large has a capacity of administering 3,000 doses per day, and the medium has the capacity of administering 1,000 doses per day. This has to do with the facility type and the facility capacity. The new sites are, the 2 large are Wayne County Community College, Ted Scott campus in Belleville, and Wayne County Community College in Harper Woods. The one in Bolded started operation on Monday, yesterday, so we opened our first site in Belleville yesterday. The Harper Woods is expected to open sometime next week. For the medium sites, we have 2 sites. We have Lincoln Park Community Center in Lincoln Park and Flat Rock Community Center in Flat Rock. Flat Rock also opened its doors for operation yesterday as the first day, and it's going to continue as we go along. So the 2 new sites are expected to come along very soon. Our goal is in a week or so. We are using the funding for these sites and the increased capacity, a mixed funding. We had a small grant from the state, but we also have a bigger reimbursement mechanism or grant from FEMA that is funding that. These are up to amounts. We are not using all the amount, but the total is close to $23 million in supporting this. The call center is currently operating through THAW as a short-term solution. There is an RFP that is also out, and we are looking for a long-term solution for a call center. There is technology needs, as I mentioned, the inventory system, as well as we needed laptops and ancillaries for registering and handling registration on sites. Those were funded through the FEMA funds, and they are purchased through several vendors. For increased capacity, we need people that can administer vaccine, but we also need people that can handle the logistics, such as traffic control and registration and the greeters. We also needed entities that can handle the supplies. So we have those as clinical and non-clinical, and we split those as enhancing capacity at our 2 current sites. Up to 2.5 million. This is a grant that we got from the Michigan Department of Health and Human Services, and we have sought 3 different vendors that are going to provide nurses and vaccine administrators at our 2 current sites to reach that capacity. However, we also need vaccine administrators at our 4 new sites, And again, we are using close to up to $12 million of the FEMA funds through 2 vendors that are providing the nurses that are needed. For logistics, operational supports, and supplies at the 4 new sites, we are using close to $11 million of the FEMA funds and using 2 vendors in supplying these services. We know that in order to be able to open up, at least for the 2 new sites and enhancing our capacity at the current sites, we had to purchase some supplies. So the county did purchase directly from McKesson medical supplies, and that was close to $350,000. This was also some of the FEMA funds. Lastly, the last expense is, excuse me, all the 4 sites, including the 2 existing sites, are entities that we negotiated with the owners of those facilities to lease those, and we have reached an agreement, and there will be expenses for those leases. In total, that is close to $880,000, and these are also using the FEMA funds. Most of these contracts are processed as an emergency procurement, which I believe are coming to the commission for approval. I think this week, if I'm not mistaken. Some of my colleagues can confirm that. I think this is my last slide, and I'll be more than happy to answer any questions either regarding this expansion or the COVID cases.
Thank you, Dr. Hamami. I wanted to clarify for those that are 16 and under, we were at first telling them to take the Johnson & Johnson. Is that correct?
No.
What are we recommending for 16 and under? And
at this point, Madam Chair, nothing. At this point, so the only vaccine that is approved for under 18, and that is 16 to 18 years old, is the Pfizer. And the Moderna and Johnson & Johnson are 18 and above. We know that there are currently clinical trials that are being conducted. We expect that sometime within, hopefully, the next 4 weeks, there will be some ruling on whether 15 years old to 18 years old can take the Pfizer, but that has not been ruled yet.
All right, and for the various other variants, I guess there's about 5 of them now.
Yes.
Do we find that the vaccine is helping to curtail the spread and or the I guess the deaths or sickness?
Yes, so far there has been out of 250,000 people that are fully vaccinated in Wayne County, there has been only 30 cases of vaccinated people who did have the infection. So that is almost 0.01% of that population. There has been only 1 death out of the 30 cases, and there has been 1 critical hospitalization. So we know that the vaccine is preventing infection, and it's certainly lessening the severity of the disease itself.
Great. And my last question, do we have any statistics, or are we even looking at how the antibody treatment is working or isn't working? Are we, because I know that there are entities that are asking for those that had COVID to give blood for their antibodies. Do we have any information on that?
Not in numbers. I'm sure there is something, since we do not treat, then these numbers are probably more with our health systems. But we know that there are several antibodies that are used in treatment as treatment protocols, and we know that they have been effective in again in the treatment of cases. So I'm not sure whether they are still getting those antibodies from infected plasma. I believe they are now able to synthesize those in the lab.
Thank you. Commissioner Anderson.
Commissioner, you're on mute.
Anderson? Yeah.
I think the other two commissioners were ahead of me, just trying to be fair.
Oh, okay.
Thank you.
Then whoever's next.
I had my hand up. Is that all right?
All right, Commissioner Marecki.
Okay, thank you, Madam Chair. Doctor, just a couple questions. Will those J&J shots that we have last indefinitely?
No, but they have a longer shelf life than, if stored correctly, they have longer shelf life than the others. So far we are still within the period that we can still use them. I believe Friday there will be some ruling whether to use it with restriction or to use it without restrictions. I doubt that it will be banned completely. I believe there will be a reinstating of the Johnson & Johnson as a appropriate vaccine.
Okay, good. Now, is this I may have, oh, go ahead.
Can I ask a question to that point?
Sure.
So with the Johnson & Johnson and the risk of the blood clots, would any restrictions be like for someone who is they have certain medical conditions that put them at risk for medical or for blood clots, or I know like when women go on the birth control pill, they tell you not to smoke because the combination of those two put you at greater risk for blood clots. So would those be some of the restrictions or suggestions that if we go back to using Johnson & Johnson?
I really don't know, Commissioner, because again, I think this is what the NIH and the CDC are doing in studying those 6 cases. The common denominator between those 6 cases, that they were all women. They were between the ages of 18 and 45, which is a wide range of age, but they also had low platelet counts, and which is, as you know, a blood component. Whether they reach a conclusion that yes, that is a risk, and that means probably restrictions should be done in women that have low platelet counts or not, I cannot speculate until the scientific data is out.
Okay, all right, thank you.
Okay, the next one, this FEMA monies chart, is this all the FEMA money we've received so far, or is there still some left over?
Okay, I can ask someone to help me with that answer.
Hi, this is Janelle Allen.
Thank you.
I'm not sure, it actually would need really Shantika Bullard, but Janelle Allen, Chief Operating Officer with the County Executive Evans Office. My understanding is that we have submitted an application, which they call expedited funding, which this is with FEMA, and that they had approved us receiving, I believe, $36 million, which we may actually have already. But this actually is being managed under our grants management team. But that is my understanding, that we did have received $36 million upfront.
Okay. Yeah, okay. And we might have been told that, but all this money, I can't even keep track of this stuff. I don't know how you guys are all keeping track of this stuff.
Right.
Okay, and then my last question, I've been asked by at least one of my communities about this lighthouse, which I'm not familiar with, but it's a statistic. They can get their statistics on how many people were vaccinated, what the demographics are. I don't know if that's what people are putting into a database, like when people are getting vaccinated. I know in Livonia, the fire department puts in data all day long with people coming in. First of all, am I correct in that? And can people get access to that, like leaders in cities or townships? That data.
You're very close to to it, Commissioner. Yes. So we've been informed that the state has this tool that is called Lighthouse. It is still in its beta version. It is yet a testing software. It is not final. I don't know who can have access to it or not, but I know that it tracks those that are receiving doses of vaccine, first dose versus fully vaccinated. It has some capacity of demographics and race and ethnicity, but it's tracking it down to the census tract. Census tract are associated with zip codes, and then zip codes are associated with communities. The current data that we are seeing is in census tract, it requires a lot of manipulation in matching those census tracts to zip codes. So we can say, for example, community so-and-so, this is the percentage. We are able to do that, but we're not able to do it every week. This data is refreshed every week. It is going to be a very good tool in understanding the vaccine rate in our communities, and by that we will also know the vaccine hesitancy in our communities. We are looking currently on how we would use some of this data to highlight who is a low, where are some of the low vaccinating rates in some of our communities, and maybe look at whether we need to emphasize on those or not. So your communities are correct. There is this tool out there, but again, I don't have this as a state-run tool. I don't know who has access to it and who does not.
Okay, and it sounds like it's kind of a process and work. I mean, they're not using the data, they're not giving you necessarily the data that you can start really using at this point?
No, it's I think a website with a repository of the data where you can download it and look at it. There are some reports that they show the trends, and these are useful that I can share. They're not community specific. These are county specific. For example, the percentage of anybody over the age of 16 in Wayne County, excluding the city of Detroit, that have received any dose of vaccine is currently at 30%. However, the percentage of those that are 65 and older that have been vaccinated are at 69, close to 70%, which is quite impressive. Mm-hmm. And that is in Wayne County. So we can get some data like that.
Okay, some kind of some general data.
Yes.
Okay, so are you guys I'm asking these questions for somebody else, not for me, but so are you really using this as a tool right now? I mean, is it being helpful right now to you?
Because it's still in its testing stage, we are trying to see how can we use this data, as I said, in identifying where maybe more efforts into awareness and messaging should be done.
Okay. All right. Thank you very much for that. Okay, that's all I have, Madam Chair.
Thank you, Commissioner Marecki. Commissioner Dodd.
Thank you, Madam Chair. I've got a couple of questions. So which locations will have the Pfizer vaccine that our 16 and 17-year-olds can take? Is that going to be consistent?
Yes.
Just so we can put it out to the public.
The only location that will not have Pfizer is the Schoolcraft Community College. The Taylor location, Wayne County Community College downriver, the Belleville location, as well as the Flat Rock location are currently serving Pfizer, and the two new locations are going to be as well, unless we receive a clearance for Johnson & Johnson. I believe we should probably have one site that is offering Johnson & Johnson.
Okay, so Schoolcraft's going to have Moderna. Everyone else will have Pfizer.
That is correct.
Okay, wonderful. What about booster shots? I've had a lot of people asking me, when do I need to come back for my booster shot? Do we have any information on that yet?
Although there has been a lot of talk about possibly having a third booster shot, we don't know when that is going to be happening. If it happens, we certainly will. We're going to follow up on that.
Okay. Okay, and then my last question is, and this is sort of anecdotal, my experience in my community is that we seem to have, we're not at like we were when we started offering vaccines, where no one could get an appointment. You know, I was at a clinic last night in Canton. We were doing walk-ins. It was pretty slow. It was an evening clinic, so we were hoping people were going to take advantage of that, you know, come after work. And it was really slow. There was never a wait. I think that, like, if you want an appointment, or if you want a vaccine, you can find one right now. But I don't know if you have heard that from other communities, that the clinics are slowing down. They're just not seeing the amount of people come in. Do we think that that is vaccine hesitancy? And I know you talked about the Lighthouse tool that hopefully we'll be able to use to identify communities. But what are we going to do to get those people who either are afraid or they just haven't got around to it, or, you know, how are we going to get to those people?
You're absolutely right, Commissioner. We as well as others that we are talking to, our partners in the health systems, other county health departments, are seeing a lower demand. Although last week when we did the walk-ups, we reached close to 2,000 doses a day. But I can tell you, yesterday I was at Taylor site, and as you said, it was very slow, and we didn't have those long lines and the numbers trickling in. I hope it is because there are now more venues where they can get their vaccine. However, probably there is as well some portion of vaccine hesitancy and some indifference, especially among the younger population, now that we're getting closer to the ages of 16 to 30 and 40. This is where we see the lower rates. I believe there is a need for communication, messaging. We are doing some public awareness using our social media. We certainly look for you, the elected officials, to be the voice as well in your communities. Anything that we can help you with in delivering these messages is something that we would certainly help you with. We are also looking at groups, as in entities that might have a big company or employee that have a lot of employees that might decide they want to bring all theirs. We're trying also to work with the schools to see whether we can offer it to schools per school district, so the school can manage. We know, for example, Dearborn is busing some of their students to get vaccines from the Detroit Medical Center, so we're working with RISA on something that is similar. So we're trying to enhance the vaccine rate as much as we can.
Okay, great. Yeah, and I'm especially thinking about like the younger 20 somethings who, you know, they got busy lives and they also think that they're invincible, and they're, you know, if I get it, I'll just get sick, no big deal. And yeah, how do we get them to go to the clinics, stand in line for 5 minutes and get your vaccine? So I see Janelle popped up.
Yes,
Did you have
I
something
did
to
want to
add to
just chime in that as part of our, we are working, Bill Nowling, our Director of Communications, he is leading a big public awareness campaign. And as you said, I believe the groups who really have wanted the vaccine, they now have had access. So we're now at this group that we do believe there is a large group based on vaccine hesitancy. Some is because of, as you're saying, the younger group, lack of knowledge of the benefits. Others are concerned about lack of, we'll say, trust in government and the big pharmacies. And then some is tied to race. So we are working on a very targeted campaign for different groups that should be launching soon. But again, I think you've hit the nail on the head about where the concerns in the groups are. We feel like we've said the low hanging fruit we've picked up, and those are mostly people 65 and older, even 50 and older. And now we are with those groups that we really have to go out and, as we say, almost recruit them. We also are exploring partnerships, and one in particular is with Blue Cross Blue Shield. They have a big network, and I didn't realize they actually manage a large part of the Medicaid component. So we are exploring where they will be contacting their network, and then we'll also be able to connect them directly with our call center where they can get an appointment immediately. So we're exploring a lot of different avenues about how now do we reach those who we do believe are fitting in that vaccine hesitancy category.
Okay. I just have one final question for Dr. Hamami.
And you know what, to that point, before you move on, Commissioner, do you also think that the individuals that already had COVID believe that they don't need to also get the vaccine? I don't know if there's any statistics out there on that, but I think that might be also an issue.
Yeah, that is also a consideration. We know that even early on, when vaccine wasn't in abundance, the recommendation was that wait 90 days if you already had the infection. It might be also contributing to that.
Thank you. Commissioner Dodd?
Thank you. Just one last question. Going back to the Johnson & Johnson issue with the blood clots, do you know if the women who were affected by that, did they have low platelets before they were vaccinated, or was that, did the vaccination cause the low platelet count?
I don't have any information on the specific cases. I would suspect they probably had low platelets before.
Okay.
However, it is good to point that I think I mentioned it before. These are 6 cases out of 7 million vaccinated. So that is, the chances are less than 1 in a million. So I have a very strong feeling that on Friday or whatever that day is, the CDC is going to reinstate Johnson & Johnson.
Okay. All right. That is all I had. Thank you, Madam Chair.
Thank you, Commissioner Dodd. Commissioner Anderson.
Thank you, Madam Chair. Dr. Hamami, I just wanted to ask you, I think you touched on it earlier about the anyone that's vaccinated and the number of people that were vaccinated that became infected. And I think you said, might have heard you say that one person had passed away that had been vaccinated.
That is correct.
I guess it goes to the efficacy of the vaccine itself, and sounds like it's far under what was anticipated for the number of people that have been vaccinated already, correct?
What is far under the?
I mean, the number of deaths and.
Oh, absolutely,
and
absolutely.
Those
Yes.
that have become infected.
Yes, if you recall, Commissioner, when specifically as we talked about the Moderna and the Pfizer, they said the efficacy is 95%. Based on these numbers, it's almost 99.08%. So
do we have, you said we had a number, would you say one death from someone that we know?
So there were out of 250,000 vaccinated, there were 30 that had the virus detected or the infection. One was hospitalized, one had death. Out of those 13, 16 were health professionals, so those were at higher risk of daily exposure, and I think 12 were educators.
Okay. All right. Thank you. Thank you, Madam Chair. That's all I have right now.
Thank you, Commissioner Anderson. Commissioner Killeen.
Well, thank you, Madam Chair. And welcome back to the committee, Dr. Hamami. Good to see you. Boy, you really have an octopus now as the effort grows and you've got all this different, and I must say, I am impressed with the health department's response here, given our situation. You've done this before, Dr. Hamami. Could you tell us what the death rate is for people taking aspirin?
It's It's a decent number. I don't have the exact number, but it's much higher than the death rate of getting vaccinated or dying from the vaccine itself.
It's more than 1 in a million?
Yes.
Yeah.
Absolutely.
Well, and I just think too, this just shows the diversity that's out there in our genomes and our genes. You're always going to have somebody with a genome that's not going to match up with these diseases. That's just genetic diversity. So we're always going to have it no matter what we do. And we've seen with the disparities in healthcare, we see that there's disparities in communities that are receiving the vaccine and are open to the vaccine. And of course, we're out county, Wayne. Do we have any data that tells us where those folks are in larger numbers in the county than others? And is it possible, I don't know if it is even possible, to reach right into those communities, maybe not getting over to 8 Mile and Kelly for the vaccinations at Wayne County Community College on the east side. That's a long way to go from Highland Park, let's say. Do we have a sense, or can we get a sense of more specifically what communities are under vaccinated in the county?
That's what we're hoping the Lighthouse data is going to reveal to us. Our initial manipulation of the data can tell us where the percentages are the lowest, such as 10% or 20% or low. Overall, the general percentage across the county, I guess the average is in the 30% for all our communities, but we're looking at those that are very low. And that is the goal, as to see what are some of the barriers. I don't think it is a access barrier, to be honest with you, Commissioner, because we know that there are now more and more places, pharmacists, providers, all those are now having vaccine and they can offer it, and they are reporting that people are taking it. I think it is more convincing people, and specifically now this age bracket that we're dealing with.
Okay, yeah. And not too excited that the Brazil variant is here. That those numbers will only expand. And I don't know, I would imagine same is true of all other commissioners. Starting 2 or 3 weeks ago, my office was not as besieged as it was a month and a half ago. Where the heck can I get a shot? Now every time I turn around, there's a new place that's distributing those shots. And just for a housekeeping thing, Doctor, and don't go back to the slide, but the slide on shots given, where we looked and we said, oh, the total there might not be an accurate number that they put on the slide.
Yes, yes.
I did a quick right
it's
across.
Missing a zero, yep.
Yeah, well, I did a quick right across the board there, Doc, and it doesn't add up. There's some other numbers that are wrong there too, because it doesn't all add up to the 220, even if we put it's more like 150 or something like that. So anyway, just a housekeeping thing. Love to have accurate data out there.
Absolutely. My apologies. I updated this with the latest numbers. It seems something went wrong.
Yeah. Thank you for the very much for the work you're doing, Doctor. And that's all I have. Thank you, Madam Chair.
Thank you, sir.
Thank you, Commissioner Colleen. And again, thank you, Dr. Hamami, for that thorough report, as usual, and all the work that you and your team, Ms. Allen, are fighting this fight. So we thank you. Thank you.
Thank you, Madam Chair.
All right, we will move to the next item, Madam Clerk.
Item 2, a presentation by Bridgeway Services on its function as a care management organization.
All right, I think we have Miss Susan Sharon, the Director of Bridgeway Services, with us today.
I'm here. Could I share a screen to put our presentation up?
Yes, it shouldn't be a problem.
Okay, can everybody see that?
Yes, we can. And
Okay,
can you
great.
just introduce yourself and
Yes, I
title
sure
for the
can.
record? Thank you.
Yeah, thank you, Madam Chair, for inviting us here today. I'm Susan Shireen. I'm the Director of Bridgeway Services. And I have with me today, with me is Marquita Felder and Amreen Khan. They're two team members for Bridgeway they're going to talk about two of the specific services that we have. So I just want to tell you a little bit about Bridgeway. Bridgeway was formed in 1999 as a joint venture between the Guidance Center and Southwest Counseling Solutions. The Guidance Center has been serving the Downriver community since 1958. Southwest Solutions has been serving the Detroit community since 1970. They have many programs in addition to their mental health services, also including youth assistance programs and prevention programs. So having these strong partner agencies embedded in the communities that we serve has been key to Bridgeway's success. This is our current service area. You can see highlighted in blue are all of the zip codes, the 18 zip codes that Bridgeway currently serves. And the red dots are the office locations within Southwest Detroit and Downriver. Since inception, Bridgeway's served about 68 or over 6,800 youth. And we receive referrals for youth ages 7 to 17, but the average age is about 15. Over 60% of these youth are diagnosed with a severe emotional disturbance. Many come with substance abuse needs, a history of trauma, educational needs, and some very complex family stressors. So when we get a referral for services, we will get a referral packet that has assessments. We'll meet with the families. We'll look at the court order, what the jurist has ordered, and then Bridgeway will set up a care path and a treatment plan that's specific to the needs of the youth. And some of the services and connections to services we provide are a minimum of weekly face-to-face visits to monitor progress and monthly visits for youth and residential, individual and family counseling, group therapy, substance use education counseling and treatment, academic monitoring and tutoring, multisystemic therapy, which Amreen is going to talk about, wraparound services, youth in transition, mentoring, life skills and social skills, workforce development and job readiness, which Marquita is going to cover, peer supports, pro-social activities, community services, and many families have transportation assistance needs. So how effective have we been? Each year we have to provide the county with an annual report, and we pulled together a small amount of the data from this report to share with you. So for fiscal year 2020, Bridgeway served 370 youth in the CMO program. That doesn't include the youth assistance programs at the agencies or the prevention programs. 71% of these youth were served in the community. 80% of the community youth completed the program in less than 9 months, and the majority of that was in less than 6 months. 87% of the youth released successfully completed their probation, and 94% of the community referrals remained in home and were not placed in a residential facility. And this is one of our philosophies. It's best to treat the youth in the home whenever possible. Some additional outcome data on recidivism. 99.2% of the youth served were free of new felony convictions during active enrollment. And then we also follow youth for 2 years after they've been terminated for the program. So for fiscal year 18 youth that were terminated, we followed them for 2 years. 97.7% of those youth were free of felony convictions 2 years after completing the program. And then a little bit about our audit data for fiscal year 2020. We have an independent audit for the last fiscal year and all prior years, and they've all yielded a clean, unqualified opinion with no management recommendations. And then the county also conducts quality review audits annually. We had a case file audit, and we had 100% compliance, and 2 self audits that were 98 and 100% compliant. So with that, I'm going to turn it over to Marquita to talk about the My Next Move program.
Good afternoon. Thank you for having me.
And I'm sorry, can you give your full name and title for the record?
Sure. Marquita Felder, I'm the Program Director at Southwest Counseling Solutions by way of Bridgeway Services.
Thank you.
So My Next Move is a program embedded within Southwest Counseling, specifically for our youth and children who are in the juvenile justice programs. And so it uses a positive youth development approach to working with youth that has a real strong emphasis on youth strengths, building support and opportunities to achieve their goals. And it's really catered to the transition to adulthood, which is something that most youth and children do not necessarily get in a traditional educational setting. And so My Next Move serves youth from the ages of 16 to 21, not only in the programs, but in our prevention programs as well. The overall goal is to support youth in achieving the necessary leadership, life skills, mentoring resources, counseling, academic support, as well as pro-social activities and workforce development opportunities that will lead them directly into their transition into adulthood. And the goal is for them to be successful. So My Next Move is divided into two components. So we have part one, which is Southwest Counseling Solutions. Part two is going to be our Southwest Economic Solutions, which offer the workforce development component. So with the first part, we focused on life skill development for career planning, daily life living, self-care, housing, money management, social relationship, coordination, connection. We provide after school programming activities, connecting them with Boys and Girls Club, PAL, YMCA, Patton Park, which is a local recreation in the Southwest community. Our groups of life skills focus on substance abuse prevention, restorative practices, parent support groups, as well as an array of different life skills groups. As I mentioned before, Southwest Economic Solutions offers the workforce development portion. So they really focus on the tutorial for our students. This is what we do know is that a lot of our young people have low reading levels and math levels. And so this program is designed to help them to bring those scores and those skills up. We offer a pre and post test, which is CASAS, which is a comprehensive adult student assessment. And this it tests them on their reading and math level so that we can see where they are. Digital literacy classes, financial education workshops, topics are generated from the surveys that they actually complete. We also offer, SWES also offers additional services for our young people that turn 18. So entrepreneurship, home buyer education, and pre and post, earn and learn. And this is specific to as they are building their skills, they are able to workforce development. They're able to learn, to earn, income as they're learning their skills trade. And last is the registration with Detroit and Work for career exploration, access to job training and support, and much, much more. Next slide. So the way it is designed, the cohorts are offered in 12-week cycles. We offer a parent and student orientation to really educate them on what this 12 weeks, this intensive 12 weeks is going to look like. The classes and the groups happen after school hours, so we do not want to interrupt their traditional school learning, whether they're in an alternative school or a regular traditional school setting, but we offer those every day, Monday through Saturday, so that they're able to still do both. Groups and trainings occur weekly. As you can see on multiple days, the youth receive a stipend for their participation. They are provided with transportation. And then lastly, there is a graduation ceremony once they do complete the courses. Next slide. Currently, we are doing, I'm sorry, go back if you don't mind. Currently, because of the, obviously the COVID virus, which we have talked in great lengths about, most of the work that we do is on a digital platform. We were able to transition to a digital platform. However, some of the workforce development components, obviously, which is in partnership with SWES and Randolph Career Technical Center, those components have to be done in person, obviously. And I will turn it over to our next person. Thank you.
Now, Anne-Marie's going to talk a little bit about multisystemic therapy, which is very widely used within Bridgeway.
Hi, my name is Amreen Khan, and I'm the Assistant Director of Youth Services at the Guidance Center to talk about MST, or multisystemic therapy. It's a scientifically proven, or more oftenly referred to as evidence-based model. It's got 35 years of longitudinal data, actually internationally. It serves youth 12 to 17, and it's endorsed by SAMHSA and other national agencies as an effective model for substance abuse. It's community-based and family-driven to target antisocial or delinquent behavior in youth, and the focus is on empowering caregivers to solve current and future problems, as opposed to traditional talk therapy, which is more individually driven. So in MST, the client is the whole ecology of the youth, the family, the peers, the school, the neighborhood. It involves highly structured clinical supervision and quality assurance process. So we have not only regular traditional supervision, but also weekly supervision consultation with an expert based out of the MST Institute. And MST has cross-cultural competence data across different diverse populations, and the therapists work very intensely with families 1 to 5 times a week and are available for on-call 24/7. So the ultimate goals of MST are to keep the youth safely at home, have the youth enrolled in school or working, and out of trouble with the law. The theory of change starts with the home or the family, then targets the peers, the school, the community, and really any kind of force that has any kind of influence on the youth and their behavior, resulting in the reduced antisocial behavior and improved functioning. The other goal of MST is really to empower the parents so that they are the ones that have the skills to do this once they're no longer in services. They're able to have those skills independently of formal services. So the different strategies that are used based on research techniques include behavior therapy, parent management training, cognitive behavioral, pharmacological intervention, so they are linked with a psychiatrist if needed, and harm reduction techniques, and various pragmatic family therapies.
Okay.
Thank you.
Thanks, Anne-Marie. And our last slide has some contact information for myself, my email address, and then several websites, one for Bridgeway, the Guidance Center, Southwest, and MST Services. So I thank you all for listening to us today. I know you've gone through some other CMOs in the prior meetings, and I hope you learned something a little bit different from us today. And we can take any questions that you have.
Thank you, Susan, Marquita, and Amreen for that presentation. It was very informative. It's just great information for commissioners to know what resources you provide for our youth and also for parents and community. Clarification on how would a grandparent, say, going through issues with their son or daughter, how would they come to you for help if they needed help? Is there a direct path, or would they have to go through the courts?
All of our referrals do come through the courts, although there's some specific services that each one of those agencies, maybe Marquita or Amreen, can address that.
Yes, so if it's any court related involvement or delinquency behavior, that would go through the courts. But if there's emotional distress, and if they needed support in that way, we do have an access center and department. I can put that number up so that you're able to access services.
Yes, definitely, because we know that our young people are really hurting right now because of COVID. Not just young people, but all of us. But in particular, we have a Wayne County Commission youth group, youth council that just presented a resolution that talked to mental health for young people. And we want to make sure that that information and that there's help out there for young people is in the community, and they know that they can get help when needed. So that would be great. Also for tutoring, is the tutoring again only through the courts, or can they access directly?
Yes, so that is, so the tutoring for specifically is for those youth who are in the court system through juvenile justice or in our youth assistance program. So it is definitely specific to that. But a lot of our programs, if tutoring is a need, so if they come to us for other reasons, we have a coordination that we coordinate resources and we'll find them what the services that they need.
Okay, so if there's anyone out there that don't necessarily have a child in the juvenile court situation, they can come to you guys for resources that they might be able to tap into.
Yeah, resources and services. Yep.
Okay.
So not all services need to, like for the MST program, they don't have to come through the court. They can, and that's our biggest, source. But if they are exhibiting those behaviors or have, those same issues, they would still meet criteria. And it's actually nice to have an early intervention before they are involved in the formal justice system.
Yes, and that is really what I was pointing to, that we should be able, or they should be able to kind of curtail that behavior before it escalates. So great.
Yep, we have prevention and youth assistance also that kind of work more in the diversionary area.
Okay. And my last question is, because of COVID, as you indicated, you're not in person or working virtually. Were the participants provided with technology if they didn't have it, or how does that work?
Yes, both agencies have provided equipment for the youth and the families if when needed.
Okay.
Yeah.
Great.
And they are being served right now. They actually are doing face-to-face visits with you.
Okay.
We are doing face-to-face contacts. We have been almost the entire time, maybe in some other form. Sometimes you might drive up to a house and sit at a distance level, but they will definitely still visit the youth face-to-face.
Okay. And do you find that your numbers are increasing or increased?
They had increased before COVID substantially. And then we saw a drop because of some of the truancy numbers. We were getting a lot of referrals for truancy. And then I think we're going to start seeing those back up again now that youth are back in school.
Okay.
So I think it's been a little bit of a roller coaster.
Okay. Thank you. Commissioner Colleen.
Thank you, Madam Chair. Everything's been a roller coaster here for a while. Madam Director, you gave a number early on, I think it was the app program, 87% of the students completing their probation. Numbers are great, but they need a reference form. Without programming, what kind of numbers do we see out there for this age group actually completing their probation if they are not part of a program?
I'm not quite sure how to answer that.
Do we know that?
I don't know that we can even quantify that. Marquita, what do you think?
Yeah, I agree. I'm just trying to think of what type of research would be out there that could, do a comparison, because that's really what you're asking for.
Right.
I think most kids are involved in some sort of services, whether it's more intensive or whether it's a referral to a lower level of care for individual therapy. Most of the kids are in something.
So they're not just cut loose out there.
No.
Okay, well, I'm just trying to measure the effectiveness. The other question, and thank you guys for the work that you do. What we do with youth in this county and our 5 CMOs is fantastic. Have you guys ever looked at the MSU Co-op Extension folks? They have a lot of programs for young people. Has anybody considered that?
I believe years ago, we actually have partnered with MSU Extension. I know that we have. It hasn't been anything recent, but yes, we have in the past. But they are a great resource. So
They
something
are,
to
and I
definitely
just,
reconsider.
yeah, everywhere I go, I mention them because in the county, they provide a lot of help. And some of the things we're talking about with youth here, even like their 4-H program, right? Let's get these kids around some cows and horses and sheep. And, you know, there's a lot of therapy to be had there for young people that aren't familiar with that. So I'm just throwing that out because I've been a big fan of Co-op Extension and the work they do in this county.
Yeah,
Thank
no,
you,
I
Madam
think
Chair.
I'm in total agreement. It's important to expose. A part of our program is just exposing young people to various, opportunities. I think that's critical. So thank you for that recommendation.
Yeah, thank you. And thank you, Madam Chair.
Thank you, Commissioner Colleen. Are there any other questions from commissioners? All right, if not, I want to thank our guest again from Bridgeway Services for your valuable service to the community and information. Thank you again for coming.
Thank you for having us today.
All right, have a good day.
You too.
Madam Chair, Madam Clerk, next item.
F, such other matters as may be properly submitted before the committee.
There are no other such matters. Next item.
Public comments.
We would like to open it up for public comments. Anyone that would like to make a comment can do so. Anyone out there? Did we get any emails at all?
No, we haven't received any emails.
All right, then it looks like no public comments today. Next item.
Adjournment.
Their motion to adjourn.
So moved.
Art Anderson.
It's been moved and supported. Thank you all. Have a great rest of your day.
Bye.
Thank you, Madam Chair. Yeah.
All right.